Dr. Annie Bukacek is a board-certified internal medicine physician and sole proprietor of her medical practice in Kalispell named Hosanna Healthcare. She's been practicing medicine for over 30 years, most of those years in Montana. She got her medical degree from the University of Illinois in Chicago, did her internship and residency of internal medicine at Oregon Health Sciences University.
Brace yourselves and please pay attention and let what I'm about to tell you sink in. The assumption of COVID-19 death can be made even without testing. Based on assumption alone, the death can be reported to the public as another COVID-19 casualty. The March 24th, 2020 National Vital Statistics System memo states, and I quote, "The rules for coding and selection of the underlying cause of death are expected to result in COVID-19 being the underlying cause more often than not." End of quote. The CDC report of cases in the U.S. memo from yesterday states the death numbers are preliminary, quote, and have not been confirmed. So, quote, the results are preliminary and have not been confirmed, end of quote. It's from the CDC website. Here's a quote even more laden with meaning. Stephen Schwartz, National Director of the Division of Vital Statistics, says in answer to the question as stated in the organization's COVID-19 alert, quote, "Should COVID-19 be reported on the death certificate only with a confirmed test?" Check out his answer, and I quote from this memo of which I have a copy, quote, "COVID-19 should be reported on the death certificate for all decedents where the disease caused or is assumed to have caused or contributed to death. Certifiers should include as much detail as possible based on their knowledge of the case, medical records, laboratory testing, etc." End of quote. I'm sure you all feel so reassured the government is asking doctors to provide their very best guesswork. Not. Fact, quote, "COVID-19 caused death," end of quote, and quote, "assumed death by COVID-19," end of quote, are not the same thing. And for those who died from something else and had an incidental finding of COVID-19 positivity, dying with COVID-19 is not the same as dying from COVID-19. I'm almost done, but want to clarify the process with another patient example. This is something that could happen commonly. It's not a specific patient I'm thinking of. Let's say it's a sick patient who goes into respiratory arrest at home. He is intubated at home by EMTs. They put a tube down his throat to help him breathe. He's taken to the hospital by ambulance, put on a ventilator in the ICU, put on antibiotics for presumed sepsis, given IV fluids because his blood pressure has bottomed out. The bacteria pneumococcus is found in the blood and sputum cultures. Pneumonia is seen on the chest x-ray. Despite the staff's best efforts, he dies 2 days after admission. Like I said, this is not an uncommon scenario. The patient was found to be COVID-19 positive, and the doctor has the option of listing on the death certificate that COVID-19 is the immediate or antecedent cause because the doctor theorizes that COVID-19 contributed. Either way, it goes into the data bank as caused by COVID-19. To reiterate, if a patient tests positive for COVID-19 and dies from another cause such as pneumococcal sepsis, it may be considered accurate to say that person died with COVID-19, not from COVID-19. Yet the CDC guidelines list they list this case as one more COVID-19 death, and they go to the next questionable death. They label that as COVID-19, and it goes on and on. You could see how these statistics have been made to look really scary when it is so easy to add false numbers to the official database. Those false numbers are sanctioned by the CDC as of their memo yesterday, April 4th. I have made physical copies of those memos in case more people start looking at their website and they decide it's too much truth for us. I hope I was able to make my point. The real number of COVID-19 deaths are not what most people are told and what they then think. How many people have actually died from COVID-19 is anyone's guess. Again, God only knows. But based on how death certificates are being filled out, you can be certain the number is substantially lower than what we are being told. Based on inaccurate, incomplete data, people are being terrorized by fearmongers into relinquishing cherished freedoms. Thank you. Oh, and I have a little PS. Forgot about. You can't have a true case fatality rate without testing massive numbers of people, but that is another topic. What is that old saying? Something along the line, figures don't lie, but liars sure can figure. Thank you.